Welcome to KIMEcast, where we break through and cut the BS in sports medicine, rehabilitation, and sports performance, and talk about how things really work. And welcome to KIMEcast. I'm Tony Mikla. This is Russ Dunning. So let's dive a little bit back into artificial intelligence and AI. We haven't really talked about this in a little while, and kind of update maybe some of the things that we're doing in the clinic, what we're doing out of the clinic, what we're looking at from like the future of the profession as far as how we can use AI to better patient care, to better delivery, to better the patient engagement in the process overall. So I think that everybody's kind of more familiar with it now. We started talking about this a couple of years ago, and it was certainly like threatening. There was a big threat, I think, that people felt, especially as clinicians, and some very much still feel this threat that AI is going to maybe replace the clinician's role in engaging with the patient. And I don't know so much that we really feel that as a threat as much as we definitely see that there's going to be a change in role, perhaps, or a change in expertise that needs to happen as a clinician that is working with a patient that's very AI-informed. Mm-hmm. Do you agree? So we have these, nowadays, for the last 20 years, we've seen a patient would come in and the patients from they searched Google already. They got a diagnosis from the doctor. They went into Google, they searched it. They know something about that diagnosis. Sometimes they know quite a bit about it. Sometimes they've watched some videos. Sometimes they understand where it's coming from. Sometimes they understand their options. But usually it's pretty kind of a gray amount of information. They weren't sure how well it applied to them. And now with using AI systems like ChatGPT or some of the others, Gemini or Grok, they're asking questions about, hey, I have this condition. What would you do for it? And the feedback is really clear. It's much more clear, much less gray. You might do these things. These would be recommended. Do 1, 2, 3, 4. It's more kind of, they've searched the internet and organized it down to this list of things to do, which can be powerful. There's still a question that the patient has, that the therapist has to be able to answer is, those things are probably accurate. Our finding has been they've usually been quite accurate as far as the right things to do. The question is, when's the timing to do them? And to what intensity do you do it for? And then perhaps like how long do you do this until you take the next step to go to like another phase or another progression, right? So because what's really well documented, which is what these AI bots are reading, is these agents are reading very documented protocols or very well documented research articles that really handle the first few phases of rehab quite well. Mm-hmm. It's pretty well documented. And then it gets pretty gray again from like, okay, I can move my arm. The pain is now minimized. I have decent range of motion. But now the questions become like, well, how do I get back to throwing, or how do I get back to Olympic lifting, or how do I get back to doing a recreational workout, or how do I get back to just running? Those things are still answered, from my experience on using these tools over the last year. They're still answered in quite a gray fashion.
Yeah.
Like, well, you should do a little bit of this and a little bit of that, and then, based on how you feel, which is true.
Yeah.
And then I think that's where we come in and have a role is, as a clinician, it's going to be your responsibility to hopefully have the same knowledge base that AI has. That's really the thing. The knowledge itself is going to be free now. So you no longer hold the cards to say that, well, I have the knowledge and you don't have the knowledge. That's no longer going to be an effective sales tool. Never has been. Mm-hmm. But many clinicians have used that, something to hide behind. Well, I know the stuff. You don't know it. So there's kind of this
secrecy.
Yeah, secrecy and like overpowering, like superiority, like white coat syndrome. Like, hey, I've got you. You need to put all your trust in me. I've got you.
Yeah,
right?
Yeah.
Where that is no longer going to be an option. Now it's going to be we both have the same knowledge.
Yeah, or at least the availability.
Yeah,
with this to the same knowledge.
Exactly. And then the question is, well, how does that knowledge apply to me specifically?
Yeah,
it's going to be the real art here.
And for how this I think plays out, probably for the extended future. I think this to me is the huge difference between artificial intelligence or the current agents and superintelligence. And the right now for the foreseeable future, the AI is generally quite smart, but not specifically smart. And what I mean by that is it doesn't really quite know you, and it's not going to take a bold opinion on you. It's going to take a very general, like what's the median? What's the average of what people think? What's the average of what the research shows? And the other unfortunate thing is research is always behind by at least a handful of years, if not 10.
Close to 10 years.
Yeah. So the best way of doing something right now might not be validated for another 5 years. And so then it's like, all right, well, how gutsy is the agent that you're talking to, and how well does it know you? And so if we're interacting with a person, I might have some general knowledge of how to help out someone's back pain. Say you're a quarterback and you have a back issue. And what does quarterback do when they have low back pain? And I could tell you like, oh, here's 5 general things to work on. And I could speak philosophically about it like any agent. But the best version of me is, well, let's do a full evaluation. And I have about 30 questions for you. And I'm going to have you do about 40 different movements. So when people interact with an agent, if the agent can't literally see you and watch you move, and maybe doesn't probe you for that intense evaluation of 40 different questions, then it's going to give you a very bland milquetoast response. But if you come to a PT that knows something and then is tech enhanced, maybe I'm a tech enhanced PT, and rather than me say I know everything, how about I just put all of the findings that I get from your detailed exam, then I pump it through AI. Now I have a much more thorough understanding, especially as a new clinician.
Yeah, perhaps. Except most of the AI agents are not going to know what to do with that data because they're not reading it online, right?
No.
I mean, you can read the protocol, but the protocol isn't going to change a whole lot with those details objectives, like because it's just so complex. But I think you're absolutely right. That comes down to like the clinician's gonna have to do the eval. They're gonna have to find these objective findings and then know what to do, how to interpret those objective things, and then bias towards like the AI said do these 5 things, but these 2. Or these 2 plus 1 or 2 other things is really going to be kind of the difference maker for you, particularly because of X, Y, and Z.
I think there's a soft science, and we'd like to reference the hard science. The hard science might be, how good is your blood? Let's do a blood test. We could say, how strong is your tissue? You could do a strength test. And maybe we look at how good is your heart. We look at your resting heart rate and training heart rate, and do a few other objective, really clear. You can't hide behind this number. This is exactly you. And then there's the softer science of how every mammal is. It's like we'd call it kinetic linking, we would call it motor control, we would call it coordination, and we could give you a few cute tests like a Y excursion test. We could do a rolling pattern and judge it. But it's soft. The soft science of motor control. We all control our body a little bit differently. Our nervous system is different. And all you have to do is watch the Olympics and pay attention to gymnastics or dance or martial arts, and you'll see the array of human movement. And judging that gets a little soft, gets a little, based on my experience, that's not a good movement for these reasons. And I think this is where objectively we struggle, but the best clinicians are able to say, this is where you need to work on. This is not good. And an agent would have a very hard time doing that. Yeah. And have a very hard time even looking at your video and saying you're not disassociating well enough in this area. And I think it's going to struggle for a long time to get there. Yeah. Then maybe one day it does it better than us, but there's a lot of experience of trying to see how someone puts it together. I think that's what an expert is. An expert kind of gets here's that word, gestalt. They get the essence of the person's movement. Are they hypermobile and floppy, or are they overly stiff and guarded? And that's the softer science of things.
You used milquetoast and gestalt in less than a 5-minute window. I mean,
I know. Yeah.
Who knows where this podcast is going to show?
Yeah, the soft science. I know.
Well, I think that we've welcomed this change, and we feel like I think what you just said there is that I'd want to comment that I don't think that the average physical therapist can do that.
Yeah.
As we stand here today, I think that if let's say there were 1,000 PTs doing orthopedic physical therapy, I think that of those 1,000, less than 100 could actually do a movement analysis and a kinetic linking understanding, and then put the objective information in and watch the person move and actually come up with a really, really good plan. I think that's extremely hard. Now, we do a tremendous amount of training and development for our team and for the community to get people to be able to make that ability to do. But it's extremely, it's very, very challenging because there's many skills that are required to get there. And I think that what we've seen in the past in our industry has been this, hey, you have a knee problem. Here's the handout of exercises to do, or here's the email of like, do these 4 things. And there's a number of people this has not worked for years, and they've been like, that's not good enough for me. I want something more custom, which, we ends up seeing them, which has been fun. And that's what we love to do. But I think that particular group that has been doing like, hey, come in, I have knee pain, therefore you get these 4 exercises just off the book, that an AI agent can do very, very well.
It's going to make them a lot better. Yeah, I think an agent in that situation
that is going to replace
10x of what that person can do.
That's going to make it, that therapist is going to get replaced by the agent. It's a pretty much of a wash. Now, if the therapist learned how to use the agent and that information was fast and easy, then they could expand their brain to do the next phase much, much better. But I don't think their systems usually allow for that. So I think that'll be an interesting change in how it challenges the field.
Well, right now, if you dropped me in a country that didn't have access to physical therapy, but they did have access to a cell phone and AI, what I would for sure do is I would assess the whole imagine I could assess the whole town, all 3,000 people in that town that had and they all had issues, and they all hurt for some reason. All I have to do is get a good movement analysis and stability analysis. If I did that and I powered their agent with that information, all right, now listen to your agent. Now the agent knows you like I know you. It's going to help you for a few years. Just pay attention to that.
Let's say that differently. So for an AI agent to work, it has to have good input. Like it has to be able to read something that's knowledgeable, right? So we've built our own AI agent. And in building our own AI agent, our goal is to have clients of ours or other people that maybe aren't clients of ours be able to use this agent. But ideally, that we would have the client's information inputted into the agent, and then we've already educated the agent with all of the way that we approach patient care. So all of our movement analysis stuff, our connect linking stuff, all of our objective findings, all of the tests that we would do, so that it knows and has read our material and looks at it as a primary resource. And then it has a secondary resource of the rest of the internet. So in doing this, as a client of KIME or as a person, you can go into this agent, you can ask it questions like you would of your therapist. And then it's going to look at what we've taught it, and it will basically give you an answer, right? So what you're saying is that if you went to another country, you would use our agent, who's educated on information that you've built into it, and then you would add a few objective pieces of information that you would gather from them live.
Yeah.
And then you'd ask it what to do. And
on the back end, we're saying these 20 things matter a lot. And on the front end, I'm then supplying those 20 things of information.
Yes.
And they're like, that's the person. That's
and then it knows exactly what to do because it bases it off all of the stuff that we've written and educated and looked at the proven literature on and everything else we've built to it. So in that case, it works. But if you were to take, I would argue that if you did not have our agent and you were just using Gemini, and you said, here's these 5 pieces of information, tell me what to do with this patient, I don't think you would get quite the same content because a lot of this stuff's not written. It's not published in that way. What's published is protocols and maybe some philosophy, and you could read some blogs and stuff. But I feel like it's not going to give you quite the depth or detail of what we're talking about.
And the reason for that is humans are not mice. And it's really hard to put mice on a proper stability stamina protocol because I've yet to see a mice do a Turkish getup. So because mice are not humans, it's really hard to have great objective science with this kind of stuff. So you need a framework, and then we pressure that framework with important values or buckets or factors, and we have what we call a continuum. So we built out the continuum of things that matter for human movement, and then we've filled those buckets with key ways of testing that are native to us. We're saying 15 seconds here is good. We're saying 25 pounds here is good. We're saying 15% of your body weight here is good. So we put an opinion. We made a stamp and said, this is the line. And when someone says, is that research backed? Say, not yet, but we're forming our research study to do so. But it's really hard to study, 14-year-old female soccer. That's a really hard thing to study because there's not a lot of money in that.
Right. Remember what research is, right? So there's double-blinded, peer-reviewed research is one version. There's clinical excellence or clinical experience is another version. And then there's case examples, right? So 2 of the 3, it's absolutely proven. We've been proving it for 20 years in what we've been doing. But no, it's not double-blinded because you can't double-blind exercise very well, which is why it's not done and why exercise never comes up as the proven method of treatment.
Yes.
Because that's not what's being tested. What's being tested is pill A versus pill B. And to your point, that group's very well funded. So there's lots of research being done on that.
Right, because every exercise research is going to somehow say, we taught all 20 subjects how to do this exercise for 3 different sessions, and then they did this A and B. Like, therein lies the problem, is that they're good at that drill for 3 lessons. So when do you judge that they're appropriately skilled enough for this exercise in this group, in this cohort, to actually be researched the parameter that you're considering? Because really all exercise is really just showing that motor control learning is chaotic. It's very hard to grade. That's it. When you read about all these things, it's like, well, this exercise does this. Yeah, for that person with that coach. Change the coach, change the timeline, change the cohort, change the age, you get different outputs.
And 2 or 3 weeks later, it's going to be different than it was then because they're going to adapt.
They're going to adapt. Motor control is that finicky and that difficult. It's like, it is a very tough thing to study, and we're putting an opinion on this. So that's the fine tuning of a general model. A general model, like, let's just assume all of the big 5 are all really smart, and they all know the general internet, and we're saying, this is what we believe. This is our strong opinion, bias, this information. If you don't do that, what are you standing for? You're just standing for the average of the internet, and we're definitely not the average of the internet.
Yeah.
I want to be on the better version of the internet, and that's an opinion.
Yeah. So what we're saying about this opinion that anyone can relate to if you're not a clinician is you have an opinion on professional athletes probably. Maybe you could say that you think that DK Metcalf is a phenomenal wide receiver, which I would say that he is. And then I might ask you, well, why do you think he's good? And therein lies the separation as to like what makes him great versus what doesn't make him great. And then you could do this with every athlete that you think of. Like we could talk about Damian Lillard, why he's great, why he's not great. We could talk about SGA or Jokic or any of these guys out there. And the difference is what Russ is saying about building up thresholds is that we could look at that athlete, we would break them down slightly differently than maybe the average person would. The average person would say that person's really successful, so they're a great athlete. That's true, but you would also appreciate that DK Metcalf is a very different receiver than like Brandon Ayuk, for example, or that Jokic is a very different player than Damian Lillard. Both are great, but do different things in different ways. And so we want to break down what makes them better, what makes them successful, why are they better in certain situations. And that's what's really, really hard and not really commonly known or done. But be able to break that down and then give thresholds. I bet that person can do, I bet we've been testing people for years, so we can know that like usually a person that moves like that can do X, Y, Z very, very well. And a person that moves like this can do A, B, and C very, very well. And they have different strengths.
Absolutely. Well, I think how to read all of that and those nuances, if you look at artificial intelligence, it's going to help a lot of people in this way, in health and fitness and wellness and performance and, doing their sport, living their life. But it's going to empower the person that has a deeper understanding. It should power the clinician more so than power the patient, although it's going to help patients a ton. It's going to help people a ton. But in a patient's hand, in a physical therapist, a good PT or a good chiro, a good movement specialist, they'll be able to prompt that AI appropriately. And those prompts might be something like this person's hypermobile versus hypertonic. They've got a hip intrarotation issue. They have a weakness about their right ankle. They're going to give the nuances and details of a deep analysis, and then that will become the prompt. And now the AI is going to become very enhanced. If the AI has an opinion, like our agent, if it has a strong opinion of kind of where to land rather than the average milquetoast of the internet, and then it's really wonderfully prompted, which takes a smart person to kind of give all the factors that matter and find out. Yeah. It's not like even if you say, "Hey, agent, tell me what I should find out about myself," and then you're just going to say, "Well, can you touch toes?" And then you're going to attempt it, and you're going to say, "I think so." Whereas a better movement specialist would look at that person and say, "No, your sacral angle is only at 60 degrees. You're hyper kyphotic through your entire spine. Your ASLR is not contributing enough to your toe touch. So these are the dysfunctions associated with that movement." All right, now the agents can be much better because now it knows you how we know you. But without that prompt, it's pretty general and perhaps negligent. Perhaps just flat out stupid. It's going to be a really dumb agent, even though it might know a lot of the internet. It's going to be dumb on you.
That is the mastery, is really like, what's the input you put into it, and both in two folds, right? What's the input on the backside that you've given it to reference, and then what question do you ask it? How good is the prompt? Mm-hmm. Yeah, I don't use it nearly as much as you do as far as like regular use of it, but the prompting is really a strong learning curve. If you're not, even if you are an expert, like to even have like an expert clinician prompt an AI agent or even our AI agent effectively is.
Yeah.
That's not going to be natural.
Yeah. I also find like the current agents are very agreeable. I don't know. They almost meet you where you are. Let's just pretend that the modern intelligence of AI is like around a IQ of 130. They won't present as that kind of IQ. They'll kind of give you like 100 when you first ask them. Oh, tell me about this. And they'll give you like a very blah. You say, and then if you bring some intelligence to it, like, what about all these factors that you forgot? Then it'll say, oh, you want to raise the bar? Great. All right, now I'll show you what I really know. And then you have to meet them at that level. Because if you can't interact at that higher intelligence level, it's going to be over your head. So it kind of does meet you where you are. When imagine going to any doctor and saying, can you come down to where my understanding is about blood and about my liver and about my brain? Like, no, you want to go like, what's your opinion on me? You're the authority. Yeah. And the agents will have a hard time being an authority. They're going to be more informational, and it's going to be the information of what you can handle or what you put into it. So
have you found that they're wrong and that you have to correct them? Be like, what you said there is not true.
So yeah, it's interesting. Well, because most of these are language models that people interact with, they're wrong with math a lot. So that was a big part early on, like simple math, like blew them. I'll still find mathematically they can be a bit off. So I think, but you'd have to ask
because they're referencing someone else's math.
Yeah. Well, no, yeah. I think it has to do with like, it's all predictive text, and it's deep. Frankly, it's way deep science that I just don't know. I'm not going to speak to it. But are they wrong? They can be in a personal kind of custom fashion. They can be horrifically wrong, and it's because that they didn't know all the information needed. Yeah. So they have a general opinion, but it can be completely wrong because you actually didn't ask the right question. Yeah. And isn't that like Sherlock Holmes?
Yeah.
You have to ask the right question. Like in physics, I took like 2 years of physics in grad school, or in both undergrad and graduate school. And the physics teacher would always just say, like, ask the right question. You have to learn the right question to ask, and then the solution is there. And that was like all of, I think, strong science and strong math professors kind of teach you that.
That's what business school is too, right? Same. Yeah. If you ask the right question well enough, then you'll know what to do.
Yeah, and so let's just say that's the intelligence that's needed, is asking the right question. And if that's the limiting factor, then the agent's only going to be as good as the question, and the question's only going to be as good as your understanding of the problem. And well, then you need to still find someone. You need to talk with the doctor, talk with the lawyer, talk with the dentist, talk with the accountant, talk with all these professionals. You still have to interact with the professional to actually understand your problem.
Yeah, 100%. I think it'll be cool. I mean, it's a bright future on how it's growing, and I think that what will be really interesting is how certain agents are, educated or informed, like the one that we've created for our system is educating it with our stuff as a primary, then the general internet as a secondary. So it really has like a strong reference point as to where to work from. It's pretty cool.
Yeah, my 12-year-old, like, I don't think she's been on Google. She just asked ChatGPT. And then if she asks for like a workout today, and I'll give her a workout, and then she'll say like, was this a good workout? I said, well, remember, you're trying to get faster in a linear fashion. She's like, oh yeah. I said, also, you're quite strong, so you probably need to do as much strength stuff, but really focus on turnover. Oh, it's a good point. See, again, she asked a general question. Like, oh, the better question is, well, I'm in track season. I'm a linear athlete. I'm already strong enough. I'm working on my speed turnover. Now what workout should I do?
Yeah.
Oh, by the way, I'm a little tight with my posterior line. so like, that's the question, honey. And she's like, okay, so should I do it? I'm like, yeah, do it.
Well, on TikTok, they just do this, Dad.
Yeah.
Yeah, those are called A-skips. Do more of those.
But man, when you prompt a agent that's, knows what it's doing, man, it's phenomenal. It's probably better than, it's for sure better than me, better than any of us.
Yeah, that's what can be scary, right? Is it is so accurate. Like, again, the knowledge is good, but the cue is, can you prompt it properly enough to get the tool you want?
Yeah.
And then is it educated enough by the right system? Like, what system is it reading from?
I know. How about you dive into that? Like, everything that we've done from a fine tuning back end. Like, can you just rattle off everything that we've done to like try and improve our agent?
Yeah, so I mean, we use like we teach anyone like that's in our system, is you have to evaluate the person as a whole. So we use our pyramid, our health pyramid, to be like, all right, do you have the fundamental basics? Can you sleep? Are you eating properly? Do you have a stress management system? And then do you do any kind of daily movement? Those would be the big 4 pillars. So fundamentally, are those in check? So to answer if that's right, then we have to tell the agent what the thresholds are. Mm-hmm. What does it mean to eat well? What does it mean to sleep well? What does it mean to move enough? And what does it mean to have a stress management system? So giving it that kind of background information is extensive. And then the second layer of that pyramid is, quality of movement or how much movement. So for that, we would more grade a movement cycle. Like, we'd use tests like the SFMA or a functional movement screen, or we'd use our force plate testing and database system to be able to gather more objective data around how good is your movement quality relative to what you want to do. So if you're a baseball player, what's your vertical jump may be less important than what's your rotational power number. So that threshold's going to be different versus if you play basketball, you're going to have a vertical jump threshold that's going to be much more superior. That's important because it's going to be more pivotal in the gameplay, whereas rotational power for that particular athlete's not as translative to performance. So having these databases and these kinds of data be valuable as far as what level of movement you are. And then the top of the pyramid is going to be performance, so how well you actually perform, which we haven't trained it because that's basically statistics. So if you play baseball and you hit 300, that's good. It knows that already, mm-hmm. right? Or if you play basketball and you're averaging 22 points a game, that's good. Mm-hmm. If you're averaging 8 points a game and you're a starter, then your performance is probably could use improvement. Maybe you do something else. Maybe you have 14 assists. Mm-hmm. I don't know. Mm-hmm. So, but anyways, that's already well known by the internet as what's good and what's bad as far as the performance goes. What's not known so well as the movement box and that fundamentals box. So that's kind of all of that for us has been well written, well documented, because we use that in training our own team as to how to evaluate all of those criteria so that we use it well. And then we look at, all right, if you're going to work on movement, where are you at in the movement cycle? So we call that our continuum. Or if you're on the far left of the continuum, that'd mean that you're in pain and you probably don't move very much at all. And then as you move more to the right, you start having mobility restrictions and then become less mobility restrictive. And then you are a little weaker, then you start building more strength, and then we work more towards power or explosiveness. And then we work more towards performance, which is more of reactivity. Can you react to an external stimulus? Can you respond to, can you hit a ball that's thrown at you at 95 miles an hour? Versus in the strength category, you have a strong swing. But in performance categories, I can hit something that's moving that was thrown in such a way that I'm not supposed to hit it. So your ability to react and adapt to the stimulus is a big factor. So where are you at in that continuum? Well, there's a test to be done at every level to know where you're at and what threshold you're in. So are you in more of a mobility level, or are you in more of a strength level? Or are you in more of a power level or more of a performance level? And then based on that criteria and based on the threshold, we can place you there, and that's going to determine where we start, right? At least with your limiting factor. You could have, like, say you had an upper extremity injury or your shoulder was weak. So if you're a baseball player and your right shoulder is weak, that's your throwing arm, we might expect that your performance on rotational, your swing velocity, your bat velocity in the swing might be diminished, or that your ability to throw might be diminished, like distance or velocity might be diminished. But yet in the lower extremity, your power output and vertical jump might be excellent. So we would continue to train those things up to the upper echelon of the continuum. Let's train vertical jump, let's train speed, let's train power, let's train leg strength at a very high level. But our arm-wise, we're stuck here in the lower end of the strength pyramid. So we have to kind of work here and work our way up that ladder. until we catch up and they're both in the more of an equal kind of high performance level.
I think the beauty of those two frameworks, both the pyramid framework and then the the performance continuum framework, one, they're quite sticky. I think people can wrap their heads around them. It's psychologically really, it allows for good, clean communication to a patient or athlete. The clinician understands it, and it steps into actionables. I think both, again, the pyramid and the continuum, there's direct actionables that can be done. Every human can improve their performance and ability to recover and heal and really kick butt in life by like looking at that framework, testing themselves in that way, and then doing programs that help improve, whether it's the stability, stamina in your shoulder, whether it's the movement through the ankle, it's your squat pattern. There's something for every person to kind of engage with that blueprint. And it lines up really nicely with like putting together your homework. And that turns into an exercise routine.
Right. And the reason why this matters, like I think this is probably important to give some examples of why this matters. So let's say that we tested you and we found that your strength was subpar, you need to build more strength. Let's say it was the same thing as the shoulder, you need to build more strength in the shoulder. So we identify what movements are weak specifically, and then we give you a recommendation of, okay, do these movements every day. I want you to do 3 sets of 12. You're going to go to fatigue state. I want to make sure you burn out. You should fail every time you do it. You get an off recovery day, or you're going to get 24 hours off and then do it again, depending on the tissue and what we're doing. But let's say we load them to failure. They do it 4 days out of the week. And then we would expect, the science would suggest, that if we did that every week you would probably gain strength for at least the first 3 to 5, 6 weeks. And then you'll probably hit some sort of plateau. So that's my expectation when I give you that recommendation. If it doesn't happen, so let's say you come back in 2 or 3 weeks and we've looked at, you've been doing it. Well, first off, we assigned it to you and the agreement was that you were going to do it. You come back in 3 weeks and then we reevaluate the strength. And let's say the strength is somewhat better, but not as good as we expect it to be. The question is why? Did you not do it to the regimen prescribed, which was super scientifically based, mind you? So that's one. If the answer to that question is no, I did everything, everything's good. Okay, so we take that out of the equation. Now it's like, all right, why wouldn't your tissue have responded? You loaded it in the way that we wanted you to. You did everything properly. What else could be missing? Well, maybe you weren't eating enough caloric intake, or your protein level wasn't high enough to actually stimulate a change in the soft tissue. The way that it doesn't have enough energy to actually grow so it can generate more force. So if we just said exercise is a solution, we didn't look at nutrition, then we'd be missing something, right? Which is very, very commonly done, very commonly missed. Second variable could be that, all right, maybe you were eating really well, you did it as prescribed, but you still didn't get stronger. Now what? How well are you sleeping? If you're not getting proper sleep, like if you're an adult, you're not getting 7 hours at night. If you're a kid and you're not getting 9 hours, and you're doing this great strength regimen and you're eating well and doing everything as prescribed, but you're not doing that, we may not see, maybe you don't have enough recovery. You're not giving your body enough time to recover. It's not growing fast enough to catch up at the rate that we hoped it would. So that could explain your deficit. If all that's good, and then we can ask maybe a question about stress. Like, is there something that's been more stressful in your life, stressful moment that's kind of locked up your nervous system in such a way that it's not adapting to this other stimulus we're giving it? If we're giving it a stimulus like strengthening that really is not moving the needle from a survive or die standpoint, and you have some other stress in your life that's much greater, well, then your body is not going to respond to the exercise stimulus. It's going to respond to the stress stimulus and going to give all of its attention over there, which is going to use up all of its resources. So it's just going to kind of like survive your little exercise that you're doing, but doesn't really care. You know? So that's why these two things interact and are so critically important. And in doing this for over 20 years now with patients and with athletes, I can't tell you how crystal clear that is when you see it. And I can't tell you how muddy it is when you don't know to look for it. Because you feel like an absolute ass, like in your first couple of years of a clinician. At least I did, where I'm like, dude, you're doing the exercise. I told you to do it. You're doing it. It's like we're having a fight here, you know, and yet you're not stronger. Like, what the hell, you know?
The math doesn't add up.
Yeah, and I thought for years, like, this has to be something mechanical. Like, clearly, like, maybe the tissue is torn, which it could be. But oftentimes, that's not the case. Sometimes it is, but oftentimes it's not the case. Most of the time, there's some of these other limiting factors, and that's why we've brought those in so strongly early on into our assessment process with clients, is that if you're not sleeping, if you have some sort of overwhelming stress in your life, or you're not eating properly, those factors are really, really hold heavy weight in your ability to adapt. And that's what we're trying to do. When we load your body to get you stronger, we're trying to get it to adapt. And if you don't give it the tools to adapt, then it won't. And then everyone will look stupid. Like, well, you're exercising, nothing's happening.
Yep.
And this is what we see all the time.
Yep.
Like we see it in weight loss. You see it in all kinds of fitness. Why can't I do this exercise? Why can't I get better at this? Why can't I get better at that? It could be that you're not loading it enough.
Yeah.
That's always everyone's first answer, which it probably is accurate because that's usually the case. But then there's the other three.
Yeah. Well, I think that loading assumes that when you do any kind of pattern, any exercise, you're assuming that you're loading up your limiting factor. You're loading up the area that you're weak.
Yes.
And in reality, the body, I said this for years, that compensation is survival. Yeah. Our body is built to duct tape structures and to guard structures and protect structures for survival into that next moment in case we have a threat like a grizzly bear running right at us right now. Yeah. So we are designed to survive, and that means that we're designed to compensate. And as we age, we kind of collect these like little issues. We fell, we injured this, we postured in this way. So we kind of collect these micro compensations or major compensations. Yeah. We call them dysfunctions. And so by labeling this performance continuum and putting people in these buckets of basically identifying like a problem list, almost as if you're a car. We got a little flat tire on this side, your axle's off over here, your steering doesn't go left very well. We kind of tease out the body in this mechanical way that helps us, derive solutions of exercise solutions to say, address this first, then address this next, then address this next. And it is a framework. And this framework, we've taught this for years. I think the cool thing about teaching something for 10 years is we've continued to update it. And part of that updated is having short articles, infographics, a few tables, a lot of drawings, a lot of workshops, and frankly, a lot of templating and exercise and coaching and videos. We've done all this to kind of tease out these really basic frameworks that we lean so heavily into. And it's this that we've spoken to with quite a few podcasts just like this. We've done a lot of internal video content. And this has created our fine-tuning agent. It's an agent of collected, it's probably like upwards of 200 or 300 hours of just digital content and probably another 100 hours of reading content. And that's the system. That's the intelligence. And the interesting thing about research too is, in our framework, it is research backed, but we kind of have to, I use AI research a ton, but I'll say, hey, I want recent research on hip stability drills that focus on the piriformis and gumilius and what are the best drills for it, and then change at that level. So in other words, I prompt the research. I'm looking for this. Has anyone studied this? And oftentimes it'll say, no, Russ, we haven't analyzed what DSI is for the rotational athlete. Of course you haven't. It's a great freaking idea, but of course you haven't studied it. So usually I'm met with, research doesn't shine any light on that. Yeah. But the more objectable, is that a word? The more objective of a question I frame it, then research is done. For instance, tell me mitochondrial density in the average cell of the human. Oh, okay, you can give me that. Say, all right, well, what's the range? How low can that organelle be and how high can that organelle be? And then give me the documented concentric, isometric, eccentric exercises that have documented change in the mitochondrial density. Boom. Then it gives me rooted science because you can biopsy the cell. I can have someone do an exercise in front of me. I can load it to failure, and then I can biopsy it and get a really clean measure. And so that's the stuff that we really know, because it doesn't involve kinetic linking, it doesn't involve the nervous system. But as soon as we get outside that hard science and we get into a squat pattern, which is like, everyone squats differently because of our ratios of femur length and tibial length, then it's like, it gets messy in a hurry.
It's highly variable, yeah. Absolutely right. Yeah, so when you have a really clear objective number or objective finding, that works really well. But when you start getting to some of these the human organism, how dynamic it is, it's really, really tough to objectify everything, which is why there's such poor science on nutrition, because it's so hard to like stabilize, and so many things matter. Everybody's got a different gut biome, and everybody's, got different diets and eat different times of the day. I mean, and the system's just adapting to the stimulus it's put into, so it's really dynamic. Yeah, it's hard to say that if you eat this way, this is going to happen to you, because if your biome's different, if your food schedule is different, if your exercise regimen is different, if your stress level is different, if your hormone makeup is different, then you may not respond to that diet the same way other people do, which is why people get so frustrated.
So frustrated. I was a big nutrition research guy about 10 years ago, and I was so like mind boggled about like beef. Like, is beef, I'd ask the internet, is beef bad for you? And say, yeah, for sure beef is bad for you. I'm like, why is beef bad for you? That was a hard question. Like, well, we think it's because of the fat. Like, well, isn't grass-fed beef different fat profile than grain-fed beef? Yes, that's true. Oh, okay. So are you doing any research right now on grass-fed beef? Like, no. Like, oh, okay. I can see why everyone's so confused on like the quality of beef. You mean that $2 beef is different than that $15 per pound beef? Who would have known that a 10x factor in cost would be so different? But that was like 10 years ago. I was like mind boggled. Now, thanks to, so many things, that's like more known. But 10 years ago, it was not known.
Oh yeah.
It was so not known. It was just like, what are you eating beef?
And nutrition was like the black box. Yeah.
Yeah.
Be careful with eggs, careful with butter, dairy, beef.
But have all the chicken you want, even though they're so big breasted, they can't even stand up straight. Trust us, that's healthier.
That's it.
Like, wow, what? Have you seen that chicken? It can't even stand. You're saying that's for sure healthier than the beef that's roaming the land? Okay, wow. But that was 10 years ago research, and I think we're getting smarter as decades go by. Or you're just seeing the propaganda for what it is. I'm not sure what kind of propaganda is with the squat, and I know the banana doesn't have a lobbyist. So sometimes like the healthiest things for us.
I bet it does. It's right. Depends on who produces it. Chiquita banana probably definitely has a lobbying group.
I guess avocado does too.
Or Dole does. Yeah. No, I mean, whoever sells it, man.
Yeah. Maybe.
I love the man. That's Shema stuff, right? Follow the incentive, and I'll show you the system.
Yeah, that's for sure. Chiquita. Yeah. Okay.
I don't know if they still make bananas or not. They're still in business. I haven't seen it in a long time.
Yeah.
But I think Dole is somehow. Anyway, I think it's going to be, I think AI is actually can be, like you said, tech enhanced is the way to look at this. If you can go back and say, I'm better because of this tool, and you can take what's amazing if you're a clinician using AI, you can learn so much from it. I would encourage you to do that before you engage with the patient. Get yourself, like, double check your own knowledge. Like, if you believe that, hey, this is what I would do, and then ask it if it would do the same thing. And then it can really like kind of give you a really nice idea of like, or if you're in the right ballpark or thinking the right way or backing your thoughts on what the current research says. But then you have to then be able to enhance it and move beyond that. And say, okay, those are the basics. Those are the basic objectives. Now I'm going to take this and add more movement science and more, multi-directional stuff to it, more different types of loads and more complexity than what it can give you. But if you're just staying at the basic level, then I think that you will be met and beat in the very near future. Yeah, you can't beat the speed or the accuracy at a bit of a basic general level. But if you can take that and use it to your advantage, and now focus your time on creating that next space between, like, can I make it more complex and make it more intense? Can I change it up? Can I apply this information with what I know directly about the client in front of me? That's where you're going to become much more powerful.
Well, if my 12-year-old doesn't know who Google is, but she definitely knows what ChatGPT is, I think it's very soon that every single patient coming in will know what general AI says about their pain syndrome. Mm-hmm. And then what's going to happen is they're going to have knee pain somewhere in the front half of their knee, and they're going to come in with a thought that's anterior patellofemoral pain syndrome or patellar tendonitis, and you're going to poke at their joint capsule, and you're going to rotate their tibia, and you're going to do a valgus stress, and you're going to say, oh, you went skiing, didn't you? This is an MCL strain. It's just on the anterior fibers, so it looks like generalized anterior knee pain, but it's actually right at your MCL. And then they're going to say, oh, you're good. Or you're going to say, yeah, I guess it knows what it's doing, and it hurts with the squat, so it must be anterior knee pain. It's like, that's going to be the difference. It really comes down, it's going to come down to the skill of your hands, the skill of your test, how well for you to interpret the movement dysfunction. We're going to have to become, it's going to force us to become better.
Absolutely. Yeah, I think it'll be a great journey. A lot to learn on all behalfs, but we should welcome it, learn from it, because it is such a phenomenal tool to like comb through research and background information like faster than we can as a human. And if we can use it in the healthcare sector to like get us to caught up to like what the research is, what the knowledge is that's been proven, and then you could just bridge from there to like what this person needs, that can be really, really powerful, especially for like developing skill sets of clinicians where they don't have all of that experience or background information, or you can't possibly read the research in time. It's just insane.
Yeah.
To think that someone can read hundreds and hundreds of articles and glean what they want from them. Because you have to remember that the articles aren't exactly pure. Like if there were 10 articles about a topic, like let's say like rehabbing of the ACL and return to sport, if there were 10 articles on that, 5 of them might not even be justified. You might want to throw them out because the objectives or the way they did the methods was a disaster. Mm-hmm. And even though it still got published, unfortunately that can be like that could be a political game where somebody knew somebody, they published it, or it wasn't very good, but they still published it, and they didn't really control variables very well. So you have to remember that not everything's perfect, but the ChatGPTs and these systems are quite good at looking at that and being like, hey, show me the articles on this, tell me what these articles went wrong, tell me where they went well, and you can really filter through that data so effectively. They can really give you a nice place to work from very, very quickly. It's not at a point where we use it as like a decision-making tool, like, oh, it said to do that, so I'm going to do it. But it's definitely a good way to get informed.
Absolutely.
By proven science, for sure. Thank you guys for listening and watching. If you guys have any questions, please fire away in the comments. Let us know what your thoughts are, how you think AI might change the future for you, or if it's something that you're concerned about, if you have some questions about how you think it might impact you, we're happy to jump on there and comment and engage. All right, we'll see you next time.